Hi, welcome to the Frontier Psychiatrist. I'm Owen Scott Muir, and this is part one of the problem with insurance. In some insurance markets, it's really hard to underwrite risk you can't manage. So, flood insurance is a good example of this. The government ends up holding the bag on flood insurance because if there's a flood, the insurance company is going to get killed. You can't underwrite risk you can't manage. And this brings us to health insurance and what's wrong with it, part one. So, in America, we have this law that established Medicare and Medicaid that prevents the government from negotiating drug prices historically. And when drugs cost $100, $200, $1,000, not a big deal. When one drug can cost $1.5 million, well, that's like a financial flood when it comes to underwriting the risk of healthcare. I think what probably happened is nobody imagined that drugs could cost as much as they do. But an incentive was created to have drugs cost more and more and more and more and create an unmanageable risk. Now, when you say drugs, most of us think of pills, right? But a lot of the medications that we're talking about now are biologic agents that require entire football field sized rooms full of $1 million chromatography tubes. We're taking monoclonal antibodies, complex proteins that need to be made in extremely expensive, laborious, and scientifically intensive ways. And another problem is that patent protection on drugs for rare conditions that affect maybe only a couple thousand people in the world, well, those drugs have patent protection that extends to 20 years. And so we had this very strange situation where it made sense to keep developing drugs for smaller and smaller groups of people, and those drugs needed to be more and more and more expensive to justify the time spent. But if you have a drug that's $1 million a pop, and you have a patent on it for 20 years and the government legally can't negotiate the price of that drug, it doesn't make sense for the drug to be any less than as much as you could possibly imagine charging, which is a little bit more than they charged for the most expensive drug last year. So combining orphan drugs with this inability to negotiate the prices of drugs when it comes to Medicare is what sets the exorbitant price for all of us. And this creates unmanageable risk in healthcare. And so the only option to manage the financial risk is just to not include these drugs on the formulary. So they're the most expensive drugs on earth if you can get them paid for, and it's only denying payment for them that is the way risk can be managed. And this is a horrifying situation for the very few people who have those rare diseases. But maybe one disease is rare, but diseases, plural, are actually very common. And so the chance that you're going to get hit with one rare thing or another with kind of catastrophic expense, well, that becomes more and more and more likely.